my name is Hayley and I have been working with lasers for over 20 years. So I'm going to come here and tell you about laser hair removal, but the truth about it all, basically explain the whole process, how it works, what you'd expect, aftercare, and everything else in between. Okay, so laser treatment. So whether you are having hair removal, tattoo removal, vascular treatment, ocular surgery, pigmentation, whatever you're having done with a laser, it requires a target. And 90% of the time, the target that it's looking for is colour. So when it comes to hair removal, the most important thing when choosing the correct candidate is one of the most important things, I should say, is the colour of the hair, because the thicker and darker the hair, the better the result will be. Now, I've got this, okay? So you can imagine what a laser beam looks like. It comes out of one of these things, a spot size or a handpiece, and every hair that is in that round circumference there will absorb the energy from the laser. And what happens is, it picks up on the hair follicle and the energy travels down to the base of the hair follicle and kills what's known as germ cells in the base of the hair follicle. So essentially it's DNA. It's destroying the DNA, preventing the hair from regrowing. However, it's only effective to one hair growth stage, and you've got multiple different hair growth stages, and all of your hairs are in a different stage at any one time. So because of that, you need multiple treatments to get the end result. And you see this throughout the treatment process, because you'll have your first appointment and it literally lulls you into a false sense of security. You think it's the best thing in the world, even after the first one, because you'll see such a big difference, such a big improvement and reduction in the hair. So any hairs that wouldn't have quite been caught would have probably been in the wrong growth stage. Then you have your second appointment. Your second appointment tends to catch the hairs that are in the wrong growth stage the first time round. So a lot of people after their second appointment are just blown away by the results. It's absolutely amazing, miraculous. And at this stage is when people start to get a bit lackadaisy with it. So they might call us and they might say, I've had no hair growth, so I'm going to push the appointment out longer. Or they might completely say, I don't need any more treatments at all, because the results have been so effective. Do not be fooled by it. The first few treatments aren't going to be permanently killing the majority of the hair growth. It's going to be stunting a lot of them. And you may see this if you're having larger areas done. So you might see little black dots under the skin. And that's those hairs that are just taking a lot longer to grow back round, which is why, to start with, it's quite important. It's essential that you stick to the guidelines that your laser practitioner has advised. So whether it's 6 weekly, 8 weekly, you're sticking to those intervals at the beginning, because usually the first sort of 4-ish treatments are not going to be causing permanent damage to a lot of those hair growth stages, okay? So at my clinic, we work on a protocol of 8 sessions. Now, that doesn't mean that everyone's going to need 8 sessions and they're going to be completely hair-free, because the way that we work is we treat each client as they are individually, because everyone has a different hair type, a different skin type, different medical history, different hormonal background, and that's going to change throughout the duration of the treatment. So yes, we work to that protocol, but we adapt things as we go depending on each person. So the first thing, as I mentioned, the thickness and the darkness in the hair. Laser isn't going to be effective on white hair, blonde hair, ginger, red hair or grey hair. There's no pigment, so it's not going to pick up on that. The thicker, the darker, the better, the more energy that hair is going to absorb. So it's particularly effective in the underarm, bikini areas. Lower legs tend to respond very well, but you must appreciate that certain areas where the hair might be a little bit finer and not so dense and sit a little bit more superficially will respond slower. If there's colour, still brilliant, but you might see a slower reduction than the areas where the hair is thicker. So the first thing to take into consideration, the colour of the hair. The next thing, and what's really, really vital, is the amount of pigment in the skin. So we use lasers that can treat all skin types. We've got Alexandrite, which is the gold standard 755 wavelength for white skin. And we have the long pulsed YAG 1064 wavelength for black skins, Asian skins, and sort of Mediterranean skins. And that's the gold standard for darker skin types. So both of them work really well. One's a little bit more aggressive than the other. Now, the reason this is so important is because the pigment of the skin sits in the same part of the skin's anatomy as the hair follicle, and it's our job to kill the hair without causing damage to the surrounding skin. So we skin type people using something called the Fitzpatrick scale, and that skin types them from 1 to 6, 1 being like myself, ginger, lily white, 6 being black African. And even that is very, very generic. Sometimes someone might come in and they may be having underarms, Hollywood and lower legs treated, and their Hollywood and underarms has never seen the sun, so could be presenting like a skin type 2, whereas their legs might be presenting as a skin type 4. So it's important to take that into consideration. We may be treating completely different levels, and that will have an impact on the treatment as well at a later date. This is also important when it comes into the summer months, because laser is a process. You already know that you need multiple treatments, and it's going to take around a year to get the end results with it. And at some point, summer's going to happen and holidays are going to come. So we need to take that into consideration. It's not for a client to make up their mind as to whether or not they can be treated. It's down to us. Laser will make you more photosensitive for sure. So do a lot of different medications, so do a lot of skincare products, so do most treatments that make you more photosensitive. So once you've entered into this, we've discussed that with you, you know that when the areas you're having treated are exposed to the sun, they need to be protected. However, it's far more risky for us to treat you too soon after sun exposure, because there's extra heat in the skin and we're adding heat. This is a heat treatment, and the skin may have changed colour. Now again, people vary from person to person. I don't get a suntan. If I get a little bit of a burn, it might leave my skin after about 4 weeks. My husband, for example, he catches a tan very easily and his colour will stay with him for months. So we need to consider that when we're doing our treatments. It might mean treating lower, which might mean it ends up being more like 10 to 12 treatments. So these are all things to consider when going into treatment. Third thing, and really important for women, is hormones. So if anyone says to you, I can guarantee to get rid of 100% of your hair after X amount of treatments, whether they say 6, whether they say 12, whether they say 20, they're giving you a broken promise, because especially as women, our hormones fluctuate. So we need to consider things such as contraception, pregnancy, menopause. We see a lot of women that suffer with endometriosis, polycystic ovaries, thyroid concerns, all these different things that we have to take into consideration. It doesn't mean that if you've completed a course of laser treatment and you've got those end results and you're really happy with them, and then you decide to have a baby, that all of your hair is going to come back and you're going to have to start the process off again. It just means you need to keep on top of it. Now, you might find that I see one lady and she comes once a year before the summer to have an overall top-up. We might not see another lady for 5 years and all of a sudden she just needs her lower legs topped up but nothing else has come back. I may be seeing a lady who has PCOS, polycystic ovaries, and she may have started with facial hair like a man's, and she may be coming 3 times a year, so once every 4 months, which seems like quite a lot, but for that person is remarkable and life-changing from what she started with. So again, same situation, not everyone is the same, and we deal with our clients on a very individual basis. Discomfort with treatment. We get asked this a lot, and I see pain-free laser advertised everywhere, and it's a lie. If you can't feel it, it's not doing what it's supposed to be doing. It's luring you in with clever marketing tools, or it's just not going to work. We need to heat the hair follicle to 75 degrees to kill it. You want to destroy it, you want to kill it, you don't want to soften it, you want it gone. So 75 degrees, that's a lot. Your nerve receptors pick up pain after 45 degrees, and that's like double your body temperature. So I say to my clients, if you burn yourself on the oven, instinctively, you're going to move away from it. So it's an unusual sensation to endure. You know what areas are going to be worse than others. We all know that the bikini line is going to be a sensitive area, let alone the fact that you've got your clothes off and you're in front of a complete stranger and they're coming at you with something that's going to hurt. So you are going to be a little bit intimidated. Everyone's going to be a little bit anxious. It's completely normal. Just remember that we see this and work with it all day, every day. If you do find it a little bit uncomfortable, we can take it slower. We can take our time with it. Some people just like to get it over and done with. We can use ice packs. We use a cooling system to keep the skin cool. You'll have some days where you come in and you'll absolutely breeze it. And you'll have some days where you come in and you would have woken up late. You'll be running around after the kids. You'll be having an argument with someone. You've been having a bad day at work and you'll be during your period and you'll come in for this treatment and this will be the last thing you want. But it's manageable and it's absolutely life-changing. You never get someone have one treatment and not come back. It's not a thing. So expect a bit of discomfort, it's normal. I also say to my clients, what form of hair removal is enjoyable? Like no one turns around and goes, oh, I can't wait to wax, or I'm really looking forward to tweezing my eyebrows, or getting in the bath and having an everything bath and shaving. Like nobody wants to do that. And that's the main reason that women come. It's not out of vanity, it's out of convenience. We don't have the time. We don't want the shaving mash. We don't want the ingrowing hairs. We just want the ease of it, basically. So, post-treatment. So obviously we put a lot of heat in the skin. It's very, very normal to get something called perifollicular edema. And what that is it's pinprick swelling of the hair follicle. So that might last half an hour, but it might last a good 4 or 5 days post-treatment. So remember, we put a lot of heat in the skin. We want to take the heat out of the skin. So don't go home after a laser treatment and jump in a steaming hot bath. You want to keep the skin cool, apply plenty of aloe vera gel. You can go to the gym the following day if the skin has settled, but I wouldn't say have a treatment and then go straight to the gym because you're going to be putting tight clothes on, you're going to be exercising, you're going to be sweating. So give the skin enough time to settle down. Blisters and crusting. It's a laser treatment. Lasers burn, wax can burn. So it's an extremity, but it's a possibility. Always let us know if there's a concern or you're worried about a post-treatment reaction, give us a call. We'll be able to put your mind at ease. It will be nothing that we've not seen before. We do have a doctor available, so we can, if we need to, send out creams that might be a little bit more specialised, but very, very rare. I just like our clients to know all the possibilities. Bruising, it's another thing that can happen as well. So bruising, you've got to remember, again, back to the little diagram, but your hair follicle is attached to a blood supply. So the impact of that laser sometimes can cause a tiny little pinprick bruise, and that's quite normal. It's nothing to be concerned about, but always let us know if you are worried. Prepping the skin before treatment. So some people, especially if they've been waxing, they can't quite get their head around this, but we need the hair as short as possible. So shave the morning of the treatment. If there's any hair on the surface of the skin, what the laser is going to do is, first of all, it's going to waste the energy on this hair, and we want it all concentrated in here to make it as effective as possible. But it will burn these little hairs, they'll flick onto the skin, and it will make it even more uncomfortable than it is. So shave the area the morning of the appointment. No tweezing, no waxing, no epilating, no threading. If you're pulling the hair out of the follicle, there's nothing in the skin for the laser to target. So only shaving, trimming is fine as well. Hair removal cream, that's not a problem. But nothing that's going to pull the hair out of the skin. Contraindications to treatment. So there's a lot of medications that might make you more photosensitive, but not many that will be a complete contraindication to treatment. One of them currently is Roaccutane, and that's an acne medication that's quite a strong one, which will be prescribed by a dermatologist, so not a normal one that's prescribed by the GP. It can dry the skin out, thin the skin, and increase the risks of burn. So we don't want our clients on Roaccutane, or we'll be like 6 months clear of Roaccutane. Chemotherapy, obviously, you don't want your immune system to be compromised whilst you're having laser treatment. An active suntan, and this is probably our biggest thing that we have to worry about, because getting a suntan in summer, but it will increase your risk of burns. Upon each treatment, you'll get something called an ongoing medical consent form, and that will just check that there's not been any medical changes since the previous treatment, no new medications, no sun exposure, and it will ask how the treatment results have been as well. Expectations. So what are you looking to expect at the end of your treatment results? So we say anything from around 70 to 100% reduction of the hair growth. So complete reduction or thinning in some areas is what you're looking at. A minimum of 8 sessions, consecutive sessions is advised as well. So what does the treatment process look like? Okay, so first things first, you'd start with a consultation. So we offer complimentary Consultations, so free consultations, test patch, where you come into the clinic, you meet the team, meet your practitioner, you'll sit down with us for half an hour and we will explain the whole process from start to finish. It will give you the opportunity to ask any questions. As long as medically you're suitable, we'll test patch the skin. The test patch is for us to see how the skin's going to respond, but it's a good inclination to the client to how it's going to feel, and it's going to put your mind at ease as well, because it's a bit daunting. People get intimidated by it, so it's nice to kind of meet us all and then have a little taster basically to see how it feels.